Doctor, what exactly is happening in the body with diabetes? I don't fully understand it.
Diabetes is a condition where your body either can't use insulin effectively or doesn't produce enough of it. Insulin is a hormone that plays a crucial role in converting the food you eat into energy. When there's not enough insulin, or it's not working properly, sugar builds up in your blood, causing blood sugar levels to become abnormally high.
Why is it bad for the body to have high blood sugar levels?
That's a great question. When blood sugar levels remain high for a long time, it can damage your blood vessels and nerves. This increases the risk of various complications, such as retinopathy, an eye disease, nephropathy, a kidney disease, and neuropathy, nerve damage.
That sounds scary. How can I avoid getting diabetes?
Your lifestyle plays a big role. Eating a balanced diet, exercising regularly, and maintaining a healthy weight are all important. Regular health checkups are also crucial for early detection and timely treatment.
What does diabetes treatment involve?
Treatment primarily includes diet management, exercise, and medication. Depending on your condition and lifestyle, we'll create a tailored treatment plan. In some cases, insulin injections may be necessary, but the goal is to keep your blood sugar levels under control and reduce the risk of complications.
Thank you for explaining, doctor. But I'm still really worried about what the future holds.
There's no need to worry. We'll work together to manage your condition effectively. Diabetes can be serious, but with proper management, it's entirely possible to live a long and healthy life.
Why is diabetes so harmful to the body?
Diabetes causes blood sugar levels to become abnormally high. Over time, high blood sugar can harm many parts of your body. For example, it can damage your blood vessels, increasing the risk of heart disease and stroke. It can also harm the retina in your eyes, leading to vision problems, and can impair your kidney function.
What kind of complications are we talking about?
The main complications of diabetes include retinopathy, nephropathy, and neuropathy. Retinopathy can lead to blindness, nephropathy can lead to kidney failure requiring dialysis, and neuropathy can cause numbness in your hands and feet, sometimes leading to severe conditions like gangrene, which might require amputation. Additionally, diabetes increases the risk of heart disease and stroke.
That's really concerning. How can I prevent these complications?
The most important thing is to manage your blood sugar levels properly. By improving your diet, exercising regularly, and using medication if necessary, you can keep your blood sugar stable. Regular checkups with your doctor, including eye exams and kidney function tests, are also essential.
Treatment sounds tough, but I understand it's necessary to avoid complications.
Yes, it does require effort, but with proper management and treatment, you can maintain your health and enjoy a good quality of life. We're here to support you every step of the way.
I've learned that diabetes can affect many parts of the body. I'd like to know more about how to control my blood sugar levels.
Blood sugar control is central to managing diabetes, and it involves diet, exercise, and medication. For your diet, it's important to monitor your carbohydrate intake, avoid high-sugar foods, and include plenty of fiber-rich foods.
It sounds like I need to be careful with my diet. How should I incorporate exercise?
Regular exercise is very effective. For example, doing aerobic activities like brisk walking, jogging, or swimming for 30 minutes a few times a week can help lower your blood sugar. The key is to find activities you enjoy and can stick with.
What about medication? I'm a bit worried about relying on drugs.
There are several medication options for managing diabetes. A common first-line treatment is metformin, which helps lower blood sugar by improving the effectiveness of insulin. Other medications can stimulate insulin production or help your body use insulin more effectively. In some cases, insulin injections might be necessary. The right medication depends on your specific condition, and we'll work together to find the best plan for you. Not everyone needs medication, but it can be a big help when diet and exercise aren't enough to control blood sugar levels.
Insulin injections sound painful. I'm a little scared.
It's natural to feel that way at first, but modern insulin injections use very fine needles, so the pain is minimal. Once you learn the proper technique, it becomes a manageable part of your routine.
That's reassuring, but managing everything every day sounds overwhelming.
It does take some effort, but with the right support and understanding of your condition, you'll be able to manage it effectively. The key is to educate yourself and maintain a consistent routine. We're here to help you every step of the way.
I feel a bit more confident after your explanation. Knowing that I have your support makes me feel more at ease. Thank you.
You're very welcome. Please feel free to ask any questions you have.
I've heard that once you have diabetes, you have to live with it for the rest of your life. Can you really improve your quality of life with treatment?
Yes, absolutely. While diabetes is a chronic condition that requires ongoing management, many people live high-quality lives with the right treatment and lifestyle changes. For example, improving blood sugar control can reduce fatigue, making daily activities easier and more enjoyable.
What specific improvements can be seen?
With good blood sugar management, many patients report better sleep, increased energy, and more stable moods. Stable blood sugar levels also reduce the frequency of sudden spikes and drops, which can decrease anxiety and improve your overall sense of well-being.
That sounds encouraging. Are there any success stories?
Yes, definitely. For example, I've had patients who, after being diagnosed with diabetes, completely changed their lifestyles, adopting healthier diets and regular exercise routines. As a result, they regained their health and continue to lead active lives. By regularly visiting the clinic for checkups and consultations, they've been able to control their blood sugar and prevent complications.
What should I focus on to achieve these kinds of improvements?
The most important thing is to work closely with your doctor to develop a treatment plan tailored to your needs. This will typically include dietary management, an appropriate exercise program, and medication adjustments as needed. Keeping a record of your daily blood sugar levels and understanding how different foods and activities affect your blood sugar is also crucial.
What about long-term health? Does good blood sugar control make a big difference?
Yes, it does. Long-term, good blood sugar control can delay or prevent serious complications like diabetic retinopathy and nephropathy. It can also significantly reduce the risk of cardiovascular diseases such as heart attacks and strokes.
That's very reassuring. It's clear that controlling blood sugar is critically important. There's so much information out there about diabetes treatment. How do I know what's true and what's not?
That's a great question. There are indeed many misconceptions about diabetes. For instance, it's commonly believed that diabetes is caused solely by eating too much sugar, but that's not entirely true. The onset of diabetes is influenced by various factors, including diet, genetics, lack of exercise, and obesity.
Are there other misconceptions?
Yes, another common misconception is that once you have diabetes, you'll immediately need insulin. This isn't always the case. Depending on the type and progression of diabetes, it can often be managed with diet, exercise, and oral medications. Insulin therapy is usually introduced only when necessary.
What challenges do people face when managing diabetes?
One of the biggest challenges is maintaining motivation for daily self-management. Monitoring blood sugar, managing your diet, and exercising regularly can feel overwhelming at first. Additionally, a lack of social support can make it harder to stick to these routines.
Is there a solution for that?
Yes, joining a diabetes education program can be very helpful. These programs provide knowledge and skills to help you manage your condition. It's also important to seek support from family and friends. Participating in support groups can connect you with others who share your experiences, providing encouragement and practical tips.
What impact does a lack of social support have?
Without social support, it can be difficult to adhere to treatment plans. For example, if you lack time or resources to prepare healthy meals, maintaining a healthy diet becomes challenging. Increased stress, which can worsen blood sugar control, is another potential issue.
So, managing diabetes isn't just a medical issue, it's also about the social environment.
Exactly. Managing diabetes is not just an individual's challenge, it requires understanding and cooperation from those around them. As healthcare providers, it's also our responsibility to support you and provide the resources you need to make daily management easier.
Thank you, doctor, for explaining all this in such detail. It's clear now how important support is. I'll definitely try to involve my family and friends more.
That's a great idea. With support from those around you, we can manage diabetes effectively together.
Doctor, do you have any specific action plans you can suggest to viewers for preventing or managing diabetes?
Absolutely. Prevention and management of diabetes start with small, daily actions. First, focus.